from is Ruth Cameron. Thanks. So the first speaker we'll be hearing from today is Ruth Cameron, who's the Executive Director of AQUA, the AIDS Committee of Cambridge, Kitchener, Waterloo, and area. So take it away, Ruth. Thank you.
Thank you, Ashley. Thank you to everyone who is here today. And I'm very pleased to speak to you along with my fellow panelists. My name is Ruth Cameron. I'm the Executive Director of AQUA, which does stand for the AIDS Committee of Cambridge, Kitchener, Waterloo, and area, a really long name. We are a healthcare organization in Waterloo region that supports the communities that are most vulnerable to HIV and related illnesses. And those communities are most vulnerable to HIV and related illnesses due to different forms of structural inequality that they face. So what I want to do is just hopefully give a little bit of a welcome and an introduction from the perspective of someone who's in a healthcare organization that has several partnerships in our community with other community and social services, but also with very specific healthcare clinics that directly deliver clinical services to these vulnerable communities. And all of us are working collectively to try and improve health equity, improve access for individuals, and improve outcomes for individuals who have many barriers related to having optimal health and well-being. So with regards to that work, a lot of what our services look like with the over 5,000 individuals we engage with every year in over 20,000 interactions is a lot of trying to fill the gaps, helping people get to health clinics, whether that's for seeing a general practitioner or seeing an HIV specialist, helping people find out how to access various forms of testing and treatment, and also responding to individuals who may be on the verge of a healthcare crisis. And that is what we're speaking about today. For individuals who, for various reasons, do not have health insurance, whether that's because of identification being lost in the vulnerability that comes with homelessness, or it's about not having health insurance because of the vulnerability that comes with a really rapid migration process that's related to being either an undocumented refugee or someone who has come to the country as a refugee and gone through a medical assessment process, or someone who has come to the country as an immigrant and gone through a medical process. An individual may be in a healthcare crisis at a time where there's a gap and they do not have health insurance. Something we do at AQUA is we work on something called prevention. There are different levels of prevention, and I'm not here to do a healthcare lecture today, but what we all try to do is prevent injury from happening at all. But if injury has happened, we try to do different levels of healthcare services and support for individuals that involve getting treatment for the illness or injury that has occurred so that it does not get worse, and also to aid individuals in getting supports that prevent ongoing injuries or illnesses from then worsening over time. We know that prevention and healthcare are important because they're necessary. We know they're important because they're ethical. But we also know that when we help individuals as quickly as we can, and we have resources like this insurance fund to help people as quickly as we can, we also know that it saves a lot of harm down the road, and it also saves a lot of healthcare dollars down the road. So let me leave with that and just say thank you to my fellow panelists and everybody who's in attendance today.
Thank you, Ruth. Next, we're going to be hearing from Deanna Clatworthy, who is a clinic director at Arch Clinic. Go ahead, Deanna. Thank you.
Hello, everyone. Thank you for taking the time to attend today, and welcome to all of the fellow panelists. Thank you for speaking about this important topic today. My name is Deanna Clatworthy. I am the clinic director at Arch Clinic, and Arch Clinic provides services to some of the most vulnerable and marginalized folks in our society. We provide healthcare to those who are HIV positive, as well as at-risk populations for HIV. And we provide services for quite a large catchment area. So we look after folks in Wellington, Dufferin, Graybers counties, as well as Kitchener, Waterloo, Cambridge. So quite a large catchment area. We see some really tragic stories in our clinic. But what I want to impress upon you is that we are all really passionate about providing health care and not just sick care. And I'm concerned that these cuts that the government is making are going to cause a lot more sick care. And we have folks who arrive and have no coverage for a multitude of reasons, as Ruth has already spoken about. It may be because their documentation has been lost. It may be because they've been lost in the system. So they've shown up as a refugee and had documentation, but perhaps were sent emails only in English and weren't able to read it and attend important meetings, or whatever the story is. There's lots of reasons why folks don't have documentation. But what do we do with them when they arrive? Well, we certainly, as a healthcare team, are really passionate about making sure folks are looked after, but we can only do so much in a clinical setting. So if we feel that someone is really at a risk for a healthcare event and they need rapid imaging or blood work, we need to be able to send them to the hospital. And with these kind of cuts, we're not going to be able to do that. The other thing that happens is folks come in through our hospital system. So they're often connected to care through our hospital. We get referrals from hospitals, from public health, where folks have shown up at the hospital without documentation, with HIV, or other serious infections that need to be treated. If they're not able to go into a hospital because they don't have coverage, where are they going to go, and how are they going to end up in front of an infectious disease specialist or in front of any physician where they need some desperate health care? When folks arrive and they are already diagnosed with HIV, they may have had their medications taken away from them when they cross the border. They may have been facing all kinds of stigma or laws in other countries. When they get here, they may not have access to medications. They may need to go to a hospital to get connected to care. And then they end up at our office, or hopefully they will, or at another healthcare provider. And all of us as healthcare providers work diligently to ensure that these folks are looked after. But without this kind of coverage, I really am concerned that they're going to end up without healthcare. And the risk of someone with HIV not being able to access medications, blood work, and physician and nurse appointments means that HIV progresses to AIDS. And the healthcare costs of looking after someone when they end up in the hospital with AIDS and all of the healthcare complications that come along with opportunistic infections and such is much greater to the system than if they had allowed that person to enter the healthcare system. So I ask that everyone, but in particular our government, please think about the ethics behind this. When folks come to our country and we open the door to them, or however they've landed here, we have an ethical responsibility to look after everyone and to ensure that we are providing health care, not just sick care. Let's keep these folks healthy. Let's keep them from becoming further marginalized and with greater infections and greater healthcare issues. So I appreciate you listening today. Thank you very much.
Thank you so much, Deanna. And just so folks know, if you haven't had a chance to take a look at the agenda today, we do have some time carved out at the end of this session where we will be doing a phone zap. So I'm so thankful that we have these great speakers so you can hear about these cuts and what they mean, but we're also asking you today to take action beyond just attending this call, and we'll talk about that in a minute. Our next speaker is Barbara Shoemaker, who is from the Waterloo Region Health Coalition. Barbara is a retired physician and the former medical director of the University of Waterloo Health Service, and we're grateful to have her here. Thank you, Barbara.
Thanks so much, Ashley, and thank you to everyone who's joined us today. This is a very serious concern for me, especially because care for uninsured people is an important part of public health measures which improve the health of our whole community. And as you've heard, in the case of infectious diseases, and as we experienced with the pandemic, we know that society is only as healthy as the most vulnerable people who live amongst us. I might also mention, because it hasn't been mentioned till now, that individuals who are Canadian and come from other provinces have a 3-month wait period before they can qualify for OHIP within our province. So they would also be other uninsured people that are going to have problems accessing healthcare during that 3-month period. Also to talk about the fact that pregnant women who are uninsured risk complications in pregnancy, serious outcomes for themselves and their unborn child. Individuals who have high blood pressure and aren't treated are at risk of a stroke. So there's just a whole gamut of health situations which we know are better if we can handle in a regular healthcare environment rather than waiting for the necessity of emergency care, because preventable care reduces the risk of complications and death. So to deny care to anyone is against the principles of the Canada Health Act, which legislates that care must be available to all, universal, accessible, and publicly funded. Our provincial government is driven by an ideology which values minimizing government spending and rewards Conservative Party funders. With ERs and maternity wards closing and children's hospitals struggling at 200% capacity, people are suffering and dying while waiting to see a doctor, to get a test, or for surgery. Ignoring pleas for action, our Premier and Health Minister underspent by almost $1 billion, dollars which were already designated for healthcare. Now this very mean-spirited decision, the decision to stop funding for uninsured people, it cost only about $15 million over the past 3 years to provide this funding. So this decision now reveals again, once more, that Doug Ford is not serving the people or the common good. Rather, Ford is determined to force on Ontarians a US-style for-profit healthcare and benefiting the corporations and insurance companies who are engaged in this business. For-profit corporations will close the door on uninsured people unless they can afford to pay. Minister Jones has said uninsured people will still receive care through community health clinics and emergency departments. They did so before the pandemic without reimbursement. How unfair and totally insensitive to place the extra strain of this moral obligation on care providers who are burnt out and demoralized, working short-staffed and under-resourced throughout this pandemic. What can you do? In addition to voicing objections to the end of publicly funded healthcare for all, please join the Ontario Federation of Labor's Enough is Enough campaign. We must stop Ford now, because week by week, he is finding new ways to break our public institutions, weaken our social services, and pave the way for privatization. You can also support the Ontario Health Coalition by volunteering and voting in the referendum on privatization that will be held on May 26th and 27th. Our goal is 1 million voters voting against healthcare privatization. The KW chapter of Council of Canadians is hosting a town hall on pharmacare with Avi Lewis on May 16th in the evening. It will be held at Mount Zion Lutheran Church in Waterloo. And I would ask you to please spread the word and attend. I'm going to put my email in the chat, and I would invite you to get in touch with me if you want more information about any of these events, or if you'd like to volunteer for them. We would appreciate that immensely. Thank you so much.
Thank you, Barbara, and thank you for sharing all those great events. We will be including all of those resources in the email that we send out to everyone at the end. So next we have MPP Laura May Lindo. She is our member for Kitchener Centre, and she is a respected activist and educator who holds both a master's and a PhD in education. Her commitment to building inclusive communities, both within and outside of educational environments, is grounded in her experience with putting anti-oppression theories into practice. Laura May is a knowledgeable advocate for the rights of women and girls, a respected ally to marginalized community members, and most importantly, a courageous public speaker on issues often left unaddressed in the mainstream. In 2019, the leader of the official opposition appointed her as the chair of official opposition's first Black caucus, whose role included collaborating with Black communities to address systemic anti-Black racism in Ontario. Laura May is currently the official opposition critic for anti-racism and equity, and she's the vice chair of the Standing Committee on Heritage, Infrastructure, and Cultural Policy. I know I always love getting to hear Laura May speak, and I'm so thankful to have you here today. So go ahead. Thank you very much for joining us.
Thank you so much. Laura May is also in a rage. So I'm going to try and keep it together, but I want to start with two big things. Number one, if we do not protect the most vulnerable, the rest of our communities will suffer. It does not matter what part of protecting the most vulnerable we're talking about, whether it's healthcare, making sure they have access to housing that's safe and affordable, whether it's making sure that they have access to education that holds them with love and care and support. If we do not protect the most vulnerable, the rest of our community goes down alongside them. And the second thing that I want us to keep sort of in the back of our minds as we are coming together with such great strength and courage and in the spirit of advocacy is that there are patterns that we cannot ignore. There are patterns from this government that it is near impossible for us to ignore. And one of those patterns is a desire to be reactive, even after being hit with a pandemic. There's a desire to be reactive instead of proactive. There's a desire to actually try and pitch a story to the public that it is more important to have a fund for the future than it is to invest in now when people are struggling. And I think at base, the reason that we're seeing such callous decision-making like this, like deciding with a memo that we're just going to no longer provide healthcare to folks that are uninsured, is because they believe that that story is resonating in the public. I want to tell you that from my own riding in Kitchener Centre, people are literally gathering signatures, writing petitions. They're participating in advocacy like this, where they're letting the government know and letting government members know that that is not okay, that we must do better, that we can do better, and that what is being proposed is near impossible. There's actually a question in the Q&A section that's part of the question that I have for the minister and for the premier in a letter that I will make open. It'll be an open letter that I'll post following this live stream. There's a desire to download a lot of this healthcare and access to healthcare on community clinics, but there is no funding going to these community clinics. So you're hearing from amazing healthcare workers and folks that are supporting the most vulnerable in our community. You're hearing from Aqua, you're hearing from Arch that they provide invaluable services, but a lot of why they provide these services is because our mainstream, I'm using air quotes, healthcare system is so underfunded that these organizations have had to show up and fill these gaps. But they're struggling, they're fundraising to keep their doors open. They're fighting with the government to be considered essential. They're demanding that they have more funding. But if the government refuses to fund them, then who is it that's there to actually provide support to some of the most vulnerable people in our community? In my opinion, it is a master plan, a strategy that is calculated to ensure that there's a rationale for privatizing the rest of our healthcare system. And I can tell you that as myself, Laura May Lindo, living in this world, I will not stand by and quietly allow the privatizing of our healthcare system to happen. And I am so humbled that the people across my own riding of Kitchener Centre and across the region are standing firm and speaking out and saying this is not okay. The last thing that I wanted to bring to folks' attention was something that actually happened at Queen's Park during question period yesterday. I was tuning in, there were a lot of questions from the official opposition about this decision to no longer provide access to healthcare for the uninsured. And the Minister of Health, in one of the responses, said that all we were doing was going back, the government is simply going back to the funding formula that existed in March 2020. Now, when she said that, it made it sound like there was a funding formula for the uninsured in March 2020. And I checked my emails back during that period and realized that in March 2020, and in fact, all around that same time, the only reason why uninsured folks, people that did not have a health card, were getting access to necessary health care was because migrant rights workers were fighting and saying, we are some of the people that are making sure that food is on the table for everybody in this province during the pandemic. We have access to nothing. We have access to none of the preventative health measures that are needed. We need PPE. We need you to know that we exist here. And we don't have access to healthcare when we are getting sick, and they're working in these high-risk environments. And it was as a consequence of that kind of advocacy. They had letter writing campaigns. They were contacting members of provincial parliament. They were letting us know what was happening on the ground, that the government was forced. I don't think that they chose to do it willingly, but they were forced to ensure that everybody who showed up and asked for healthcare had access to healthcare. So my question to the minister is whether or not, when she says that she's going back to this March 2020 funding formula, she's actually admitting that she's going to reverse her decision and now make sure that everybody has access to healthcare, which is what we were fighting for, or if she's really referencing before folks had access to healthcare. I will, as I said before, be putting this out publicly in an open letter, because I think it's important for us to have the actual history before us as we do our advocacy. I think it's important for us to have the arguments that have been laid out in front of all of us today. The fact that if you don't actually fund our healthcare system and fight for preventative care, that you're putting more of a burden on a healthcare system that, in my humble opinion, was already brought to its knees because of a lack of funding. I think that it's absolutely ludicrous that the government insists that they care about our healthcare workers and that they see them as heroes in everything that we have gone through collectively as a community. If at the end of the day, when they say this is a problem, the government's response is, we'll just send uninsured folks to the emergency rooms. We are literally having conversations about what's happening in our emergency rooms, the long wait times, the fact that people wouldn't have to go to the emergency room if we funded upstream supports to ensure that they were healthy and strong. And so with that rant, and it is a rant and it will continue, I just want to say thank you. I want to say thank you to everybody who has been organizing on the ground, whether it's the collection of signatures for petitions. I was was very, very humbled to be sitting with some elders and community who were actually collecting signatures from people in their networks, and gave them to me to be able to bring to Queen's Park, for bringing together so many of us in these virtual forums for us to be able to support the people that are protesting at Queen's Park. And I'm most proud of the fact that as we come together, we share the realities of the historic fight that we have had to ensure that the most vulnerable are supported. As you can tell from this live stream, many people will be left without access to healthcare if we allow the government to do this without standing up and speaking out. And I am so humbled to be here at a time where so many people are courageously standing up and telling the government enough is enough. Thank you so very much.
Thank you so much, MPP Lindo. And I think the rage is felt and shared across everyone. The amount of people that are here, the amount of people that are at Queen's Park, we know that this is a shared rage. And we will be hopefully, using that rage to continue our advocacy efforts to say no to these changes. So next we are joined by Eliseo Martel. Eliseo is a public health consultant in Waterloo Region, and he does a lot of work and provides a lot of support to migrant workers in our community. So thank you so much for joining us.
Thank you for inviting me to this event. I think that it is necessary that as many of us express their concerns in regard to what these cuts will mean for people who are just outside working, for Canadians in Ontario to have fresh food, fresh vegetables, and other food. But something that I would like to reflect is that initially the funding was created to respond to COVID issues. And by cutting this money, it sounds like COVID doesn't exist anymore. And I would like to say that COVID exists and is here to stay. And that virus has been proven to be a little bit unpredictable. And we don't know when it will give us some surprises in regard to health with the population. So for a situation that is not totally understood as COVID-19 behavior as a virus, to cut this money that is not that much and that will prevent further expenses to the health system, further costs to the health system, doesn't make any sense. So these few millions of dollars that were assigned to this situation, by cutting them, it's just, again, without any sense, because it's very little money to cover possible 10 times expenses within the health system in Ontario. So even politically, it's smart to keep the money there. And this is not only related to COVID-19. Something that I would like to mention is that the population that I usually am related to, that is the foreign workers and new immigrants through the immigration partnership, is the fact that these are populations that can be quite vulnerable. For the recent immigrants, it's usually at the first time that they are here, that can go from 2, 3, 6 months, and sometimes even a little longer, that can be uninsured. And for foreign workers, foreign agricultural workers, these are populations that are quite vulnerable in regard to their living conditions, their working conditions, and therefore very prone to have accidents or to have diseases that gets complicated for those reasons. So to stop with this funding and to provide services for some of these people, and they are not millions of people, considering the population of Ontario, is a small population. So to provide services for these people who at one moment can be uninsured is just justice. It's just to be fair. So I will invite the government to review that decision and learning that the decision is not just a bad decision from the public health perspective. but also from the emphatic and to be empathetic with this population that brings so much to the Ontario population, to bring something that is negative to them. It doesn't make any sense either. And from the money point of view, to cut 5 million or a little bit more, that can lead to expenses that can increase 2, 3, 4, 10 times. Again, even from a budget perspective, from a financial view, it doesn't make sense. So I will invite the government to review this decision and just to acknowledge, okay, we made a mistake, let's put that money back. Because by doing that, we will be covering the well-being of a population that needs services. And therefore, and that by not necessarily their fault, at one moment can be uninsured and not being able to show up the OHIP card when they come to a laboratory or to the hospital, to a urgent care clinic. So again, this invitation is to think again about that decision. And just to let you know that foreign agricultural workers are a very vulnerable population that easily can get not into 30 minutes consultation, but even to get hospitalized, because the complication of a health problem that we weren't able to address when it was relatively cheap to address due to measures like this one, cutting those funds. So again, I am inviting the government to reconsider that decision and to go back and say, you know what? Yes, let's do it. Let's change this. Okay. Thank you again for the invitation to me and being able to express not necessarily feelings. It's just to express a rational, objective way of thinking in regard to issues that are so important for the population as health care. Thank you.
Thank you so much, Eliseo. We have a participant, Dr. Laura Pin, who has her hand up. Dr. Pin, we're going to invite you to give your comments now, if you'd like.
I think my hand was up by accident. I'm so sorry.
Okay, no problem. I thought maybe you wanted to join in the agenda. Okay, so next we're joined by Jennifer Draper. Jennifer is an encampment resident, and she is one of the named respondents in the Region of Waterloo's litigation against the encampment residents at 100 Victoria Street. And Jennifer is going to share with us about her experience. Thank you so much.
Hi, Ashley. Thank you. And thank you so much for having me speak. Well, from my experience, this is a horrible, horrible decision they're making. I second Laura Malindo's rage on this. From what I can tell you, being on the street with an average of about what we've gathered 1,200 homeless people here right now, I'd say 98% of those probably don't have a proper ID, any proper ID. So health card, birth certificate, anything like that. And getting those replaced is pretty hard when you're out here. There are ID clinics. There's, I mean, for 3 hours a week, for 1,200 people, you can guess it takes quite some time to get in there, get an appointment, and get your ID. Not to mention, there's a lot of mental health barriers that prevent people on the street from following processes that are required to get replacement ID. So once it's lost, it's pretty much gone. And now these being one of the most vulnerable groups in society, there's a lot of risk, especially in you know, they say encampments, they're not healthy, and people can get sick, and I can understand that, right? Mostly, like, it's a matter of personal, like, hygiene and cleaning up after yourself, but not everybody has the mental capacity to be able to do that. So when you're putting yourself in a higher risk situation like an encampment without ID, and now the government is telling you, no, you can't have access to healthcare because you don't have a card that, you know, you may have lost 6 months ago and not even thought about until that day you get sick, right? There's so many there's so many daily things that come up that just it's not at the forefront of your mind until you really need it. And when you need it, it's been comforting to know these last couple of years that if push came to shove, you could get the care you needed. Taking that away is going to hurt a lot of people, not just physically. Like I've seen people on the street with blood infections where, you know, they were on the verge of death if they didn't seek attention, right? So are we going to turn these people away at the doctor's office and tell them to go to emerge and sit there for 6 hours because it's so backed up because nobody can see their doctors without their cards? It seems really ludicrous to me. It seems like we're putting ourselves in a position, setting ourselves up for failure almost as a province in doing this, like putting this money into allowing these people to seek care now while the issues are treatable and you know, easier, probably cheaper to treat. It sets us up for failure later on when it becomes so bad that they have to go to the hospital because, you know, they can't control their symptoms anymore. They can't control themselves. Then what happens, right? Then they have to go to the hospital, and it's, you know, hundreds of thousands of dollars more perhaps for care for something that didn't have to come to that. I don't think we want to push people away from seeking medical attention, right? Do we want to encourage them to be healthy and seek that treatment, you know, get better? If you don't, you know, go find out early enough, then, you know, you're risking, you know, possibly not having a cure for whatever ails you, right? So shouldn't we be encouraging these people to go to their doctors to get treatment, not pushing them away at the door saying you don't have the right card? You know, it seems very small and petty almost to take that away. And it's going to cause backlog in our emergency rooms. So we're going to see people waiting there with their kids who, you know, have fevers and worried about them going into a coma. Trust me, I've been there with all 3 of my kids. But why? For what purpose? I think it's going to end up costing more in the long run, and it's just going to end up hurting us as a province, as a people. You know, I'm proud to be from Ontario. Don't make me second guess it, I guess. Like, don't take away something that makes us fundamentally Canadian, right? An Ontarian, which is access to proper medical services when we really need them. And the people that really need them don't have the proper ID. I apologize for that. There's not really a process we can go down that makes that easier for them. Perhaps maybe more hours at the clinic, but aside from that, they don't have it, and they need treatment just as much as anyone else. Maybe even more so with the needs, the mental health needs that come into play as well. Is that treatment something they're not going to be able to access without their card now? We really need to make sure that the people who need the services can use them when they need them, and that we're not putting ourselves behind the 8 ball later on. So don't do this. Don't take away our access to proper medical care when we really need it. It would be a detriment. Thank you again, Ashley, for letting me speak.
Thank you so much for speaking, Jen. It's so important for people to hear your perspective, and thank you for joining us. Okay, so last up we have Fidelia Okuaji, and she will be joining us representing Nigerians living in Waterloo Region. Thank you so much.
So thank you very much, Ashley, for the opportunity to speak, and good afternoon, everyone. So I was invited to share my story as someone with lived experience. I'm going to just go back and share my story and kind of tie it into the conversation that we're having today. So I came into Canada 2013 as a student, but before then, I'll give you like some backstory. So I started my journey to come to Canada to study way before I even got married or thought of having kids, right? Because for, as we know, especially for those of us from Africa, it takes months and months to get your study the admission offer and then the visa process and all of that. So in between all of that, I got married. And when I got married, my husband and I made a decision that we were not going to start a family until, I was settled in Canada when I was done with my education and all. But as fate would have it, I found out that I was pregnant in between all of this. But before I even put in my visa application, I reached out to the school and I shared, I kind of give an update like, I'm pregnant. Is that okay? Is there a law against coming as a pregnant student? And the school, emailed me to say, no, you're good. You're fine. There's no, as long as you're here and you understand that you're on a study visa, you actually come to school, which was fine. I'm like, yes, I would be able to fulfill my, honor my study permits. The other question I asked was, I do see that I have I paid for like insurance. Does this cover my insurance? Because I know that the UK has like NHS and students were covered under NHS. I needed to get that clarity. And I was assured that, yes, you do have student coverage, which should cover all of your medical needs. So with that information, I went ahead and applied for my visa, got my visa and came in 2013 as a student. But upon arriving into Canada and trying to, I went in to start register for prenatal classes. To my surprise, I was told that if care for me would be out of pocket, that I did not have coverage. I went back to the international office and I reached out to the international office to make this complaint. I said, oh, why am I being told that I don't have coverage? I have to pay out of pocket for care. And even they were confused. Initially, at first, they were going to help me contact they helped me to contact the students coverage and, came back and said, oh, the insurance is saying that because it's a pre-existing condition, you're not covered and all of that. But I said, I did ask all of these questions though, before I came. Anyway, cut the long story short, I'm already in Canada and I'm being told that I have to pay out of pocket. So I started to do my research. I went to St. Mary's, I went to Grand River and all, they kind of like gave me a rundown of what it would cost to have a baby here. And I remember being told that you pay for triage, then triage was like $500. And for every day I stayed in the hospital, it was only $2,005. For each day, I would pay for the for the gynecologist that would do the delivery and all of that. So I was told anyways to budget about $10,000 to $20,000 for delivery. And that in itself just put me on, like mentally just messed me up. Now, bear in mind that I'm someone who lives with sickle cell disorder. So for me, it was really very important that I was getting care from like doctors and, getting like the best of care because the complications could arise. So I shared these concerns and unfortunately I was told that, you either would go back to your country to have your baby, or if you're going to have your baby in Canada, you have to pay out of pocket. And then I got told about that nurses, I could have my baby with nurses and it's free. So I registered for to have my baby with the midwives and they took me into their program. But the moment I mentioned that I had sickle cell, they immediately said, okay, we would watch. We don't know what sickle cell is. We're assuming that we should be able to deliver when the time comes. However, if we feel like we cannot manage you, we would immediately transfer you to Grand River. And I was fine with that. At that point, I was like, I'm fine, but I was seriously hoping that nothing would happen that would get me to go into Grand River. But then when the time came, I had to deliver in Grand River, right? Because I think at that point, the midwife did their research about sickle cell and they didn't want to take chances. So I had my baby. But in the midst of all of that, the moment I had my baby, the nurses came and they said, oh, we observed that you don't have coverage. There are two options. You stay here. However, if you're staying, just be aware that it's $2,005 per night. And I just straight up asked, am I cleared to go? Now, this is now me at this point prioritizing or laying, not prioritizing my health, because knowing what I had, I knew that it wasn't right for me to be leaving hospital right after birth because anything could happen. Sickle cell is a blood-related disorder. That's like the most vulnerable stage any woman can be. They could be blood clot and all. But again, I still was struggling with racking up too much debt. I already knew that I was already in debt at this point, but like, you know, just be mindful not to rack up more debt. So I said, do you guys feel like I'm good to go? Because if I'm good to go, I think I want to discharge myself. And they said, well, looking at all of the statistics, the baby, looking at your vitals, you're good. The baby is good. We don't have any concerns right now, but then again, you need to watch out for clotting and all of that. So I said, I'm going to discharge myself. And I did make the decision to discharge myself. So where am I going with all of this? These are decisions that not just myself, but a lot of us are forced to not prioritize our health and well-being because of the costs of accessing healthcare. Now, fast forward to years later, when I have my second baby, having my health card and all, and had more complication, it just really made me really see, you know, would I say not appreciate, but it really made me to see the danger that I put myself, because I then flashed back to like, what if all of this happened when I had my first baby, all of the complications I had now, what if it happened then? So it's either maybe I discharged myself early and the complications happened at home, maybe I would have I would have died or passed out by then, you know, just, I don't know. But on the other hand is, if it had happened in the hospital, I probably would have racked up like over 30, 40,000 in death, which it's just not a good place for someone who is coming here and starting their life to be. So I just re-echoing what MPP Laura May says is that, well, more emphasis should be laid on, you know, preventive care rather than already burdening a healthcare system that is already crippling to the ground. And what I mean by that is, if people have access to preventive care, you know, there's no barrier to getting medical care when you can, when you need to. We would have to sit at home, not prioritize our health, not prioritize our well-being until things get so bad that it then becomes a case that is beyond manageable. So I do agree with this, and I call and I ask that however we can make this stop, please, let's push for this not to happen. There's so many immigrants. I'm from the Nigerian community. I'm the president of Nigerians in the region of Waterloo. And I know that this is the challenge that we face every day. We have a lot of families who would not want to access the healthcare system because they don't want to rack debts. They don't want to, you know, but this should not be encouraged. We want people to be able to access healthcare at an earlier stage when things can be properly managed, and, you know, it's preventive rather than things getting bad. We've had cases where we've heard news of our members. I think last year we lost someone who, you know, they just passed away in their sleep. Nobody knows what led to that point. These are things that could be prevented. So I'm really calling and begging that, you know, as part of a minority group, the marginalized group, that this is going to impact the most. I'm calling on whoever, and, you know, we're ready to rally and support powers that may be to make this change not happen. So thank you very much. I'm going to stop at this point.
Thank you so much, Fidelia, for sharing your story. I'm sorry that that happened to you. It must have been so stressful. And it's so important for people in the community, Ontario, people in Waterloo region to hear that. And thank you very much for sharing. So we only have a couple more minutes left in our presentation. We had planned to reserve the last few minutes of our session to do a phone zap. So this is where you can take your anger and the rage that you're feeling after hearing all of this and the buildup of all of the things that have been happening in our community. And you can call, and we would encourage you to call your MPPs and leave a message or speak with them and let them know that you demand that they go back on these cuts and that change is being made so that everyone has access to healthcare. So we've shared a resource on the screen that has the phone numbers of all of our local MPPs for Waterloo region. So you'll see their name, their riding, their party, their email address, and their phone number. So I'd encourage you now to take the time to call your MPP. You don't have to call May Lindo. We know that she is in support of this and she's advocating on this issue. Same with Catherine Fife. We already got support from her office that she will be continuing to advocate at Queen's Park on these issues. But you know, I'd say email them as well. Email your MPPs, but calling is really, really effective. So also, I want to give some time for Q&A as well while this is happening. So there's a question in the chat that says, as far as I can see, it's just another way of segregating the most vulnerable people in our society. It's part of the age-old right-wing agenda, divide and conquer. So it's more of a comment. Yes, Gordon, thank you. And then I'll offer an opportunity for any of the panelists if anyone wanted to add on to the question that we had earlier. So the previous question we had was, can someone clarify about how will community health clinics be able to continue providing health services to those who are uninsured? And MPP Lindo answered that, and that was really helpful. But if any of the other folks on our panel wants to add anything to that, you feel free to go ahead. And if any of our panelists want to make any final comments, you can also feel free to use these last few minutes to do that.
I was just going to jump. Hi, it's Laura May. I just wanted to jump in really, really quickly and ask anybody who is making a phone call to a member of provincial parliament to also make sure that you shoot us a very quick note. You can email my office, you can email Catherine Fife's office. Just let us know that you made that call, because what I've also seen as a pattern is that when we contact some of the conservative members in the area, they don't reply. And because nobody knows that you have contacted them, they get away with that. And so I'm working diligently to not let them get away with that. So if you it does not have to be lengthy, just a quick note saying I called MPP whoever, and I'm waiting to hear back. That allows me to get the information that I need to keep the fight going and the pressure on. It's not about Laura May being angry about it. It's about the public being angry about it. Thanks.
That's such a good tip. Thank you. One other question we have, is it possible to advocate for a simplified process for issuing new ID for the people who don't have such? Then it will be covered by OHIP. I'm not sure the answer to that. I don't know if any of our panelists have an answer to that.
I think a simplified process would make it easier and more likely that people would follow through with the process. It's just getting volunteers to do it, right? It's like the tax clinic, they're so far behind because there's not enough workforce, right? So because everything relies heavily on volunteers, unfortunately, there aren't as many as we could use. It pulls availability, right? So they can only help so many people per day. And if they only have people that work there, like people that can volunteer the one day, then they only have the one day. So you figure 1,200 people here in Kitchener. How many homeless people are there in Toronto, in BC, and in Ottawa? You know, it's not 1,200 now. It's, you know, closer to probably 12,000, right? I don't know the numbers. Anyone know how many homeless people there are in Canada right now? It's probably a lot, and Ontario alone is probably a lot. So if these people can't have access to proper healthcare, then they're gonna end up really sick and costing a lot more money, like by the thousands of people, right? It just makes sense to proactively treat minor issues, doesn't it? Yeah, thanks again, Ashley. It was great. Thank you.
Thank you, Jen. Thanks for joining. I see Ruth had your hand up. Go ahead, Ruth.
Thank you. I just wanted to say that a simplified process is a great idea. It is important for folks who do need to get ID, but in the moment when somebody has an urgent healthcare need, we want to make sure that they aren't restricting themselves from accessing healthcare. But also, we want to make sure that the providers who want to provide them care so that they can address what's happening now. And like you said, Jennifer, make sure it doesn't get worse. Don't have to spend their time figuring out how they're going to go about getting people the things that they need. When there is a resource like this insurance fund, providers only have to worry about making the decisions that they're trained to do to make sure that we're all as healthy as we can be. They don't also have to worry about how to go about finding the resource to make sure the test happens, to make sure the treatment or procedure happens, to make sure that the medications can be procured to help people be as healthy as they can be. So I think if I had to pick between the two, and I don't, I think both are important. I really want to make sure people can get whatever they need in terms of healthcare as promptly as possible. while also, yes, we should have simplified processes for people to get ID and the other things they need as well in our society.
Absolutely. Thank you. And so we are at the end of our session. Thank you very much for everyone who's joined us. Thank you so much to our panelists for coming and sharing all your expertise. As you leave, please if you didn't get a chance during these last couple minutes to call your MPPs, please do so. Take some time today to do so. And if you're in Waterloo Region, send that quick email to MPP Lindo or MPP Fife to let them know that you have contacted your local MPP. And thank you again, everyone. We will be sending out resources so we can continue our advocacy efforts on this issue. Thanks for joining us today.